Hi, it's Craig and Lisa.
Hello, everyone.
Look who I have with me. I have Craig. Craig's back. He's back.
Hola.
Yes.
And como está?
And he knows Spanish.
Well, we are learning. Poco Espanol.
What?
Poco.
Oh, Poco. I thought you said Coco.
No.
I'm like, what? Okay.
Yeah, that's what our son corrected me on this past week.
Yes. So we are delighted today. We're having this interview. He's coming. He'll be here very shortly. And so it's multiple good things happening today. So we're interviewing. We're so honored to have Dr. Duncan.
Yes.
He's coming today to speak with us so that we can show you and speak with you. And I'm also delighted because Greg is going to do the interview with him today. Yay! So hold on, hang on. It's going to be great information, and I'm going to get back with you at the end. So
all right,
it's going to be good.
Stay tuned.
Welcome to Donnelly Studios.
So sorry.
Hello again, everyone. This is Craig, and my special guest, Dr. Duncan, is here. So thank you for taking time to join us here and to share your insights and information with our viewers. I'm sure they're pretty eager to hear what you have to say. So just kind of introduce yourself to the viewers for us, okay?
Okay. Well, thank you for inviting me. This is good. Nice studio. Hope I can be back. So, Ricardo Duncan, born and raised here in Panama, Panama City, Panama. Studied medicine in Mexico. Worked there, lived there. Between study and working, almost 10 years. Came back to Panama. Before that, I was studying for the boards, or in the States, to do medicine in the States. So I spent some time there studying for the boards. But I always wanted to do something in Panama. Just always had this mission, like you may say, like to change the view of medicine and healthcare. Saw how things are done here in Panama, in Mexico, in the States. So I try to emulate or pick the best of each place and do something. So I remember my father talking about back in the days how the doctor came in with the bag and knew everyone and did house calls and was a person. What a high conscious of what medicine is done right now. So it was a vision. So when I had the chance, I did at a Brain Smart Clinic. So in Panama, working as a doctor in Panama, 15 years doing medicine here in Panama. Okay. Speaking about Panama City, healthcare in general is top notch. Technology-wise, hospitals, institutions, medical staff have trained. Everything is top notch. After you have the public healthcare, you have and private healthcare. Public system is good, but it's oversaturated. Okay. That's how again I describe it. Public and social security, that is saturated. The human resource, like the doctors, nurses, like you're gonna find the same doctors working on the public system and working on the private.
Oh, wow, okay.
So those work in the morning in the public and then in the evening in the private, or vice versa. So they're good, they're trained. Unfortunately, there is something when you work in a system that's saturated and you get just automated. Everything is, patient comes in. It's kind of like in the States where you just see patient after patient after patient and you're like, well, it's not like 10, 15 minutes. We try to shorten the time, and that's for me. speaking about, but you cannot do good medicine that way. Because in my case, I have to sit down with the patient and not just what it's hurting, where you have it's your lifestyle, where you live, your eating habits, exercise. You have to analyze the patient to get to a good diagnosis. So there are two things: the staff trained, because you have to. It's rigorous. I work and study in Mexico, but coming here to Panama, if I didn't study here, I'd spent 2 years doing practice, getting acclimatized with the system here in Panama. So they make sure that you have what it takes to work here. Hospitals, institutions, you have good institutions, you have good hospitals from world-renowned, like the Johns Hopkins affiliate, Pacifica Salud, Panama Clinic, which is a good hospital with a lot of medical tourism. To other hospitals like IT National, you have good institutions with good equipment. So yes, and then in the public, you have good equipment, but again, oversaturated.
For expats moving here to Panama, how do they engage in the healthcare system here once they come here?
Okay. Different from the states that if you don't have like insurance, healthcare is almost prohibited, like in the States.
Yeah.
Like here in Panama, you see a lot of expats paying out of pocket because it's very affordable. Just to put an example, is in my practice, Smart Clinic and Lab, I see 98% expats and growing. And I like to
and it's going to continue to grow.
Hopefully, that's
it will.
Play this little game of like, how is, and let's say I've asked, like for a general practitioner, if you would pay out of pocket, and the average is around like $250 to $400. Here in Panama, you can have a general practitioner between 20 to 60 at the most. Specialist, the most I've seen for I think it was a neurosurgeon something. It was like $120. Yeah, dollars. US dollars, not like Panamanian, because we use the same. It's like what? And in the States, like between $800 and $1,200 a specialist, like around that, depending on the specialty. So normally when they come here, there's a lot of out of pocket, but lately there have been insurance, like hospitals that are having their own insurance. The thing with insurance is they're always on the win-win. So if you have a pre-existing condition, they'll either not cover or pay a percentage. There are certain places that I've heard that are taking with pre-existing condition, but it's investigating. But generally speaking, out of pocket is very popular.
Right.
And then the hospitals that has their own insurance in case of emergencies.
Right. So coming from the States, I would say the costs that you're explaining are typically in the same range as copays. And in some cases, you have deductibles that you have to meet before insurance kicks in. So when you compare the costs, I can see why expats definitely pay out of pocket because it's considerably less than what we're used to coming from the U.S.
Yes, you are. And if you get one of these insurances with the copay, with insurances in the hospitals, I think it's like ranges from $15 to $20 a specialist, and general practitioners that we don't have to pay for that. So yes, there is a lot of advantage for same quality of care and higher when you add the human part of it. That is not like numbers all the time. So yes, like you could pay zero to see your doctor, like your general practitioner, if you have insurance, and not even a copay. Yeah, that's it. Or certain insurances that if you have a copay, oh yeah, $5, $10.
Okay. So moving to a different country and being open to the customs and the way things happen here, and I'm going to try this. Estoy aprendiendo español.
Okay. That was like an 85%.
So it's coming, but I wanted to kind of do that in transition because, like me and my wife, a lot of us don't speak Spanish, and we're trying to learn Spanish. So, how does the care when you don't speak the language translate here when you're at either a public or private facility?
Okay. Public is going to be hard. Again, the same doctors that you'll find on the public, most of them work on the private, so you can find the elements, certain elements that speak the language. On the private sector, it is more common. There is doctor or certain personnel that speaks English, but yeah, that's very important because speaking about healthcare, you want to make sure that the one that is attending to you understand exactly what you're saying. If you're going to take out, it's going to be on the right side. But you want to make sure that the language is not a barrier.
Yeah.
Thank goodness technology, Google Translator and all this has closed that gap, but still, there are things that can be lost in translation and you want to make sure that is provided.
All right. So, just in general, how would you just describe the overall healthcare system here in Panama City, and what should expats expect if they're moving here?
Okay. They're going to see a lot of familiar things with the U.S. healthcare in terms of quality. There's even though there are a lot of things broken on the U.S. healthcare, and that's been a concern for years. Quality, when it's good, it's good. You cannot deny that. It's the care that is lacking. But quality, for the most part, is good. Here in Panama, quality is a must in private and public institution, but private at least, because we have that competition, that healthy competition between the best quality, best service, attract the best clients. That's what you want. So what to expect? They're going to see the difference on the attention, on the time dedicated to the patient. Now I'm going to talk about Smart Clinic and Lab. Like my clinic, this is what we do in this regard. Like you said, you're accustomed of going to the clinic, to the hospital when there is an issue. I always try to let my patients know that prevention is key. You go to the doctor to avoid having an issue, to learn about your body, to do preventive tests, to be on top of things before it occurs. Sit down and say, we don't concentrate on the stomach issue, because we know that stomach could be stress related, could be sleep deprivation, lack of exercise, so we try to convey and see the patient as a whole. So this is what you'll find, and there's a lot of doctors. Since COVID, healthcare has changed, shift here in Panama. We're more keen on prevention to avoid certain things than before it was reactive. So that's a trend that you'll see here in Panama.
Yeah, very good. I know you touched on this just a bit earlier, though. Can you talk a little bit about some of the specialized services because I know a lot of people that are going to be coming here, they have specialists for different types of issues that they're dealing with, and also the emergency type issues that may happen when you're here.
Oh, the specialties, you can think about of it, we got it. Like you name it, all the way from general practitioners, family doctors, pediatricians, gynecologists, orthopedic psychologists, physio, dietitians. So yes, have all the specialties and subspecialties.
Let's kind of transition just a little bit. We kind of talked about specialized services, but this is another big topic, medications. A lot of people are on a lot of different medications. So whether your insights as to existing medications when you're coming here, do you continue to get it from the States, or can you kind of just talk a little bit about the whole medications that
system?
Yeah, the system here.
One of the advantages and the good things about the insurance services in the States is that you get your medication for free or for a fraction of what it would cost. During my practice, I heard a lot of patients saying that, no, I barely pay for my special medications with this insurance that is, obviously you're paying for it with insurance, with the premium, because it's a premium to get that service. But compared, like without insurance, the medications here in Panama, there's, again, no comparison. Medications are very inexpensive compared to what it would be cost in the States. I've seen a lot of my patients come in with medications galore, with pharmacies, mini pharmacies. And when they are transitioning, they tell their doctors, like, I need 6-9 months worth of medications, and I've seen them come with it. So you can come in with your medication. The issue is, after medication is finished, getting it from the States is a hassle. I've seen one patient able to get it through the mail, but for most part, because the medications are available here, most of the medications are available here, it's easy to just get the medications here in Panama. Most of the medications have the same dosage, the same ingredients, but let's say that in the States a medication would be 125 milligrams, and here you find it at 120 or 100 milligrams. The right doctor will be able to fix that dosage, no problem. If there is one medication, because I've seen one or maybe twice in all my years, that there is not here in Panama, there is the similar, and you can just transition the patient to a similar medication and work fine. I know that there's it's a culture in the state that you just push medication, and hopefully, I'm working on that, the least amount of medication possible is the way to do medicine. But it's not just like goodwill, like I'm just not gonna take the medication because it's not good. It's work towards that. If you wanna stop taking certain type of medication because you're gonna modify your habits, your way of life, to start weaning off of that medication in a responsible manner. But to your questions, yes, medications are here and easy to get. Pharmacies is a big business here in Panama.
Okay.
Hopefully.
I guess just one quick thing I'd kind of like to ask, that if there's one thing that you would like to share with foreigners that are coming here, what is it that they should just know and expect if they're coming here in regards to healthcare?
Okay. There is way more to health than they are accustomed. Healthcare, as they know it, is just one part of healthcare. When I started Smart Clinic and Lab, the idea was to show to patients and other practitioners, other doctors, the way of another aspect of medicine, which is the preventive, the lifestyle oriented. Yes, there are still clinics that do house calls. There are still doctors that spend time with their patients, to know their patients, and to treat the disease instead of the symptoms. And that's what they can expect here in Panama, because there are certain aspects, I'm going to name them real quick. Stress that you're going to find in the States, that stress factor, you're gonna feel it leaving your body. That's one part. The food that you accustomed of being injected hormones, sprayed antibiotics, pesticides. That is not.
Okay, that's gonna get an amen from me on that one. Okay.
The air quality. There's so much green. Panama is such a thin country. Masses of water, all that permeates in our oxygen. And because we're at sea level, the amount of oxygen is just right. And based on all those things, you sleep better. Because this is a beautiful little sauna. You're gonna sweat, you're gonna perspire. Because you're drinking water, you're eating, right? You are detoxing, naturally detoxing. If you do absolutely nothing, you just come here and spend time here, you're gonna look different, you're gonna lose weight, you're gonna feel different. Imagine investing in your health. So that is the message. Invest in your health. Come and explore the other side of medicine.
All right. Well, I first of all, thank you so very much for coming here and sitting and sharing with us today. I certainly appreciate it and learned something, and I'm sure our viewers have as well. And I know that they are going to have questions. We're going to ask that if you do, just put them in the comments, and we will try to respond and get responses back to you. But could you just share how your information, if someone wants to know more about your clinic, kind of share how would you like for them to reach out to your clinic?
Well, to your question, that's a great question. Like the description is going to be placed below, so or how they can reach me. But the idea is, yes, if I could reach out as much people as I can with just the message of this. It's not new health, and it's not the best way of doing medicine. It's the only way of doing good health. And it's taking control of your body, of your health, taking the range. Like I'm sitting in the driver's seat, is wherever you are in life, you lived a certain way, believing a certain thing, having access a certain part. Here in Panama, or wherever you are, because this is going out. The idea is knowing what you're capable of. And if you think that you're healthy, that's great. But there's levels of health. Even if you're healthy, you can get to the next level. And if you're not, you can get healthy and you can have decision. It's not pharma based of health, not insurance depending on your health. It's the knowledge. Like you've heard knowledge is power. Knowledge is really power. Taking control of what you're capable of and speaking from experience until you reach that level. Because you think you're healthy because you like a certain way, until you start living and you feel healthy, you're like, oh my goodness, you don't know what you're missing. So the idea is to reach as many people as I can and just show them what they are missing.
Again, thank you so much for taking time from your schedule to join us. We certainly appreciate it again, and definitely look forward to having you back again. I'm sure everyone would love that as well. So, hasta luego.
Hasta la vista.
So, what did you think, right? Just being behind the scenes, watching these two men discuss healthcare in Panama had me in tears. Not only because of the content, but because this is what we're experiencing here. And so to have it quantified and actually put into words what we're experiencing here, it's a lot. And this is true and it's part of an amazing experience. And it also explains, I was saying that I had never really thought about just the location itself, being close to the oceans and all, and like this a natural detoxifying because of the climate. Had not thought about that, but everybody that visits us are like, they leave here different. I'm not kidding. I'm not kidding. when people come and how they leave are different, even after being here just a few days. But I just had not really put that all together. But the expats here love him, and I knew that when I first got here. But I still was like, oh, I'm gonna wait and see for myself before I say anything. But yeah, he's good. He's good. Yeah, he's very passionate about healthcare. So I hope this answers some of your questions. I do know that I get comments often about healthcare being limiting you to, or being a limitation to what you might want to do next. And again, I'm not here to say that Panama is a panacea or is perfect, but I just wanted you to know some things about healthcare in Panama from a doctor himself. So let me know what your questions are. I have all the information of how to reach Dr. Duncan in my description. Um, we do plan to bring him back, so let me know what your questions are and the information that you'd like to hear from him from next. All right. And what about Craig? Holding it down. Craig was holding it down, right? He held that interview down. He did. He did. I love it. I love it. All right. So, you know what to do. Until next time, be blessed. Be blessed. Yes. All right.